Welcome to the first ever emergency edition of the Diabetes Remission Roadmap podcast. This is just Cory here because this news was so urgent, so important, and I couldn't get Brian to meet with me in time that I just wanted to talk about it right now. So this is a crucial episode. I'm so excited I can't even talk. A crucial episode, especially for those of you who have used, are used, or planning on using a GLP-1 agonist like Ozempic. So I have been working in a clinic that utilizes what's called a patient assistance program, which means that if you have no insurance or if you have Medicare Part D and the cost is too much for certain medicines, and drug companies will provide these medicines at no cost. And so the makers of Ozempic, Novo Nordisk, for several years have provided, amongst their other medications, Ozempic and the pill form of that GLP-1 semaglutide Rybelsus at no cost for eligible patients, especially Medicare is one we really utilize this for. However, and this is, I can have Brian post the link. This is on the Novo Care website that the changing for 2026, the 2026 patient assistance program will no longer include Ozempic or Rybelsus. And there's some other medications that they cover or won't cover. That's not the point. The point is these medicines are very popular. They can be very effective. So this is not a bash GLP-1 episode. But the problem is most people in the standard healthcare system are put on these GLP-1s. They can be very effective for sugar, for weight, and they're not given a roadmap to not need them anymore. And then whenever something happens, like say coverage ends and they can't afford it, there's an insurance issue, there is a issue getting it from the pharmacy because of a back order because it's so popular, they're out of this medicine and they have not put into place the steps to possibly not need the medicine. Now, this is not shaming people who use it, who rely on it, but the point is, whenever someone starts a medicine, my goal in discussing with them is how can we get you off this medicine eventually for your blood sugar? Try to give them that roadmap to come off. And there are lots and lots of patients utilizing this patient assistance program who are no longer going to be able to afford the medicine. Now, this could be a podcast lamenting the state of the healthcare system, why do medicines cost so much? That's a different subject that needs a different expert. I'm not an expert in policy. What I am an expert in is tactical tools to reverse type 2 diabetes. And so what I just try to talk till I'm blue in the face about with people are the things you need to do to not need them, to make sure, because these medicines cause muscle loss, to do strength training as you're utilizing them so that if you stop them, you don't have the muscle loss, the lower capacity for blood sugar, the lower metabolism. Well, there's a wave of people who are going to see sugars and weights skyrocketing, I'm afraid. The other piece of the puzzle is how to eat appropriately on these. So prioritizing protein. So when you're not as hungry, the order of operations of what you're eating is really important. You have got to get all the nutrition in before you get energy in, and that can be in the form of carbs or fats, before you fill up fast, because these medicines make you not eat because they paralyze your stomach. So this is not a podcast that is breaking urgent, how do we fix this policy change? For years, the company's been giving this very expensive medicine away for free. And for years, this company's also been making, I'm sure, a crap ton of money off of it. So this is not a rail against capitalism or our insurance system. However, it is a wake-up call. I hope you and everyone you know who's taking it acts as a wake-up call. If you require medicines for blood sugar, with type 2 diabetes, and type 1 is totally different, you're going to need insulin for life. Type 2, it's hard. It can be very hard. It can be challenging. It can require a long road to get there. But the ultimate goal should be not to rely on companies that make drugs and medications and a healthcare system that's broke. And with this program, it's going to be heartbreak for thousands of people who rely on this program, which has been a godsend for them. But it's precarious. It's charity. It's not a guarantee. It's not. I'll say it's not a right even. This is a private company that's designed to make a profit, and so they're not making enough profit because I think there's other GLP-1s coming out from other companies that are actually going to be more effective than Ozempic, and they're trying to squeeze every last dollar out of the Ozempic while they can, and this is giving away a lot of product for free. So what are you going to do about it? We could increase income to pay for the medicine. We could look at different insurance coverage options for Medicare Part D. It can be very confusing and challenging. Or we could get a little pissed off and take it out on I'd like to say take it out on ourselves, but implement a plan to not need it. And whether or not you use this program, whether or not you have Medicare, it's not the point. The point is, and it's not like a character flaw. I don't want to make this feel like I'm shaming anybody for having type 2 diabetes. We say this like every episode, but our system is designed to make you sick, from our food systems to our healthcare system. It is a milieu that is designed to make us unhealthy physically, emotionally, mentally too. We could talk about social media and stress and cortisol as well. But we can either use this to be angry and shake our fist and demand to be free, or we could listen to the reality that when we rely on an outside source for a medicine, we should do our best to not need as much of that medicine as possible. And this is not saying people who rely on other medicines for other conditions for which there's no other option. This is strictly the world of GLP-1s like Ozempic in this particular program. So I hope you enjoy our first ever urgent breaking news podcast. Um, I hope you take this information to heart, share it with someone who needs to hear it. And if you're ever looking for help, we have a masterclass that, if you just watch this, would get you a long way down the road and not necessarily needing the medicines like Ozempic. And if you do need them and you rely on them and they're helping you and you're happy, great. Then keep on keeping on. But I urge you to do your best to stick it to the man. If you're angry at this drug company for taking away this free program, you know the best way to get back at them? Not give them profit by not needing their product. That's my favorite revenge, is the one where they don't make money. Not where yeah, we don't have to go into anything more than that. Don't rely on it, and they'll lose money too. So thanks for listening. Check out our masterclass. We'll link that in the show notes. And if you have any specific questions about this issue, this class of medicines, anything with type 2 diabetes, we are just itching for listener feedback and questions to answer on our next episode. So thanks for listening, and enjoy, and go look out there.
Thanks for listening. Now go ahead and hit that subscribe button so you don't miss a single episode, and you can join us on the journey and roadmap to remission. Thanks for listening to the Diabetes Remission Roadmap. The ideas discussed here are for general informational purposes only and do not constitute medical or nutritional advice. We are pharmacists, but we're not your personal healthcare providers. Always consult your own physician or qualified clinician before changing medications, exercise routines, or nutrition plans. Results vary, and what works for one person may not work for another.